Greetings. This is Mushtaq Memon, Professor Emeritus from Washington State University. Welcome back to my YouTube channel. We continue on our series of videos on integrative veterinary medicine. We started talking about traditional Chinese veterinary medicine and talked about the acupuncture on a previous video. And today we are going to focus more on TCVM diagnosis. In our Western practices, we usually start with our Western diagnostics, which usually typical is the receiving the animal, getting the history, doing our routine physical examination, including body temperature, respiration, heart rate, but then we combine along with the TCVM diagnostic technique with acupuncture or whatever we want to do for the animal. So again, it's very similar to Western medicine plus TCVM diagnostic techniques. Now, why we do that? Well, from a Western perspective, we may have a problem, same problem with us in two horses. Let's say colic in two horses. But, when we include our TCVM diagnostics, you may find out that these two horses are very different in terms of their problem. And so the approach to treatment would be different. Whereas in our Western perspective, probably colic would be treated in a very similar way. So as time goes on, you will see that there are some very, very fine details in it. But let us go on and talk about, different ways how to do that. So again, as I mentioned, the typical diagnosis will be the history and Western exam. Then the aspect which we include is the examination of the tongue, a tongue diagnosis of the animal, which gives us almost like a window to the body of this animal. As time goes on, you will see it will become a little more clear. And then the palpation, which we don't do in Western examination. So that's the other art of this Chinese medicine that we learn how to, evaluate the pulse of the animal. So then in horses, we have a very special, unique technique that we scan the animal with a little bit semi-sharp subject back of the needle or things like that to see where the sensitivity is and what acupoints. So that helps us to really pinpoint the problem. So the tongue diagnosis is kind of fascinating. So I borrowed some of these slides from Dr. Memon, and she had done an excellent job in our recent textbooks came out on integrative veterinary medicine, where she explains to us that this tongue diagnosis includes the color of the tongue, the shape, the size, the coating, and characteristics, and what region of the tongue that is the specifications of color and things like that. And then those areas or regions are divided related to different, systems or organ systems. So it comes together after understanding and then the practice. So just to simplify tongue diagnosis, just keep in mind the normal color of the tongue ought to be more like pink peach color, as you see on this picture here, which probably makes it a little more clear. And that is supposed to be a normal color. And then is a red color, as you can see. This tongue of the horse here is really red, which tells you that there is some kind of heat. And heat and cold is another concept in Chinese medicine, which fits very well whenever you start absorbing this concept in your own mind. And maybe it's too hot or maybe not enough cooling. So the red color indicates that look at it. Now then is a pale. As you can see here, it's not really that difficult to appreciate that how pale this tongue is. Why is this pale? Because maybe there's not enough heat or maybe not enough energy. So as we have discussed in our other videos, not enough energy, life energy is a chi. So it could be chi deficiency. So once we diagnose and put it together with some other findings, then we could try to correct that balance. Then there's a purple color, as you can see here. I think once you start seeing more and more tongues of these animals, you will become good at that, recognizing it. So purple gives me indication right away that there is some blockage for chi here. So it could be poor circulation. Animals in pain, many times you see these problems, interceptions, twist of certain things. I have seen in animals, you could see indication in our purple diagnosis. So again, as I mentioned before, as is also indicated here, it's almost like a window to the working body. So more you look at them, more you understand, how we can make sense out of it. Then is a pulse. Now this is another big, area of diagnostics that one needs to understand how to feel this pulse and see the depth of that pulse. Is it superficial? Is it deep? And how regular it is? And once you get into that, I think you will see that it is beneficial to look at that concept of pulse. And again, as I mentioned about the tongue, pulse is in the same way. You need to do it over and over and over to really get good at that. There are other concepts, 5 treasure of TCVM, and then a few other things that which would be very handy, but it requires more time. And as you know, there are certifications in acupuncture that one can go a little deeper and become certified, where you learn more and more. But after you have a control on the basic concepts, then it's practice. I think that's the only way that one can get good at that you get your hands on and then try to do these things. So I mentioned again some references here for your more, learning and teaching. And then I will have more videos, and I'm excited to share with you some herbal therapies concepts and some concepts of TCVM in practice to put everything together and see how this is beneficial to animals. But in the meantime, please go ahead and like, share, and subscribe this channel so you do not miss on the upcoming videos. Thank you for listening. Bye-bye.